Gentlemen, if you're over 60, I need you to pause for a moment and really listen. What I'm about to explain is not about embarrassment, performance, or private details. It's about your heart. Because there is a quiet mistake many older men are making, not by doing too much, but by ignoring an entire part of their health they believe no longer matters. And that mistake is silently affecting blood flow, hormones, emotional balance, and yes, your cardiovascular system. I'm not saying this to scare you. I'm saying it because I've seen men who took great care of their diet, their weight, even their blood pressure, but completely neglected sexual health, and later paid the price with heart issues they never expected. As men, we're often taught that after a certain age, intimacy becomes optional, something to accept fading away, something to stop thinking about. But your body doesn't work like that. After 60, the systems inside you don't shut down, they change. And when one system is ignored, others compensate in unhealthy ways. Sexual health is not separate from heart health. They are deeply connected through circulation, nerve signaling, hormones, and emotional well-being. When that connection is ignored, the heart often feels it first. Many men believe that if they're no longer active in that area, at least they're protecting their heart from strain. It sounds logical, but biologically it's incomplete. Your heart thrives on balanced circulation, healthy blood vessel function, stable hormones, and emotional regulation. When sexual health is completely neglected, testosterone tends to decline faster, blood vessels lose responsiveness, and emotional stress quietly builds. None of this causes immediate pain, which is why it's so often overlooked. After 50, and especially after 60, your blood vessels naturally become less elastic. Your heart muscle stiffens slightly. Recovery slows. At the same time, testosterone levels are often 40 to 50% lower than in your younger years. This hormone isn't just about desire. It plays a role in blood flow, artery health, muscle tone, energy, and heart rhythm stability. When sexual health is ignored entirely, these changes accelerate. Circulation weakens, the inner lining of your blood vessels suffers, and the heart has to work harder to do the same job. There's also an emotional factor most men never talk about. Emotional suppression. When intimacy disappears without replacement, without connection, affection, or closeness, stress hormones like cortisol rise quietly. Chronic emotional stress raises blood pressure, disrupts sleep, and increases inflammation. I've seen men with acceptable medical reports still develop heart rhythm problems simply because emotional and relational health was neglected for years. The heart listens to emotions more than we like to admit. This isn't about forcing activity or pushing the body. It's about engagement versus withdrawal. Men who adjust their approach, slower pace, more awareness, less pressure, often maintain better circulation and emotional balance than men who shut that door completely. The heart prefers rhythm, not extremes. Ignoring sexual health is not rest for the heart. In many cases, it's deprivation. Some early signs your heart may already be reacting include unexplained fatigue, low motivation, poor sleep, mild chest tightness during stress, anxiety, or reduced stamina. Many men chase these symptoms with supplements or quick fixes without addressing the deeper imbalance underneath. After 60, sexual health becomes less about performance and more about circulation, connection, and calm. That means no rushing, no pressure, and no comparison to the past. When intimacy is approached gently and mindfully, it supports heart rhythm rather than stressing it. And when intimacy isn't possible, maintaining emotional closeness, touch, and bonding still provides cardiovascular benefits. The heart responds to connection, not ego. To protect your heart, you must support the entire system. Daily walking, not intense exercise. Deep breathing, especially before sleep. A consistent sleep schedule. Proper hydration. Light evening meals. Regular sunlight exposure. These habits improve circulation, hormone balance, and emotional stability, all of which support both heart and sexual health. This is not about doing more. It's about doing smarter. Men who live longest aren't the ones who push the hardest. They're the ones who listen the earliest. Your body after 60 isn't broken. It's simply asking for respect instead of force. Let me leave you with this truth. Ignoring sexual health does not protect your heart. Understanding it and adjusting wisely does. When you care for your circulation, your hormones, and your emotional balance, your heart stays steadier, calmer, and stronger. Aging doesn't mean withdrawing from life. It means participating with wisdom. Listen to your body. Respect its rhythm. And your heart will reward you, not just with more years of life, but with more life in your years.